For more on the monkeypox public health emergency, I want to bring in physician at Stanford Children's Health and ABC News medical contributor Dr. Alok Patel for more on this. Dr. Patel, in an interview on GMA, Dr. Ashish Jha said that it wasn't too late to declare monkeypox a public health emergency, and that they have taken this virus very seriously from day one. But a lot of people are criticizing the administration right now, saying 78 days into this, since the first case in the U.S., now they're declaring a public health emergency. It took far less, 13 days, to declare COVID-19 a public health emergency. So do you think the administration is flat-footed right now?
Diane, it's hard to speculate what exactly was going on in those meetings from the beginning of May until now, but I agree with you. The timing does seem a little bit off, considering that we were at virtually 0 cases in the beginning of May, and now we're over 7,000, which is probably undercounting. Now, people do need to remember there's a difference between COVID-19, which even when we didn't know a lot about it, we knew it was a respiratory virus, and that spread would potentially be rapid, versus monkeypox. But I think what's important now is that we get that funding, we get that awareness, and we get the resources allocated for proper testing, treatment, and contact tracing.
One of the big worries is, we're starting to see, I know it's a tiny amount, but 5 cases in children throughout the U.S. That's sparking concerns among parents. Dr. Jha said they have not seen any cases come through playground or through public transportation, so less concerns about surface to surface. But what precautions do you think people should be taking in public spaces, both to protect themselves as adults, but also to protect their children?
Diane, I think it's twofold in terms of what steps we need to take, both as the individual and as society. As the individual, parents are freaked out. Everyone else is out there. We're getting a lot of questions about general advice towards monkeypox. The bottom line is people do not need to have the same level of alarm as a respiratory virus that travels in the air, but to be wary about anyone who may have symptoms or may have a rash that resembles monkeypox, and then do the necessary steps to avoid that skin-to-skin contact, making sure you're wiping down surfaces, washing your hands. But people generally do not need to be freaked out on a day-to-day basis. As a society, we need to be realistic and realize that right now, even though 99% of cases are in men who identify as gay or bisexual or transgender, who have sex with other men, are the majority of cases, this is a human virus and can infect any human out there. So that's what we need to be paying attention to.
And the Biden administration says that it's looking at ways to now speed up production of vaccines. We have 7,000 confirmed cases of monkeypox in the country so far. So is getting everyone vaccinated the best defense here?
And I think it's strategic vaccination, Diane, whether that is ring vaccination, meaning you're vaccinating someone who is potentially infected versus in all their contacts, or getting a vaccine out to everyone eligible in those areas where the individuals are more likely to live. Right now, you heard the estimate that we have about 1.7 million people eligible who are high risk for getting this virus. Then you heard that we have about 1 million doses. Each individual needs 2 vaccines. That is not enough. That's 500,000. So the 5-dose increased supply is a good thing, but we also need to make sure those vaccines are going to the right communities and access is equitable.
All right, Dr. Alok Patel, we appreciate the analysis as always. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.